I feel armpit incision is safer than breast incision, and I'll try to explain why in this video. First of all, there are two ways to do breast augmentation through an armpit incision. One is what we call blunt and blind approach. The other way is what we call an endoscopic approach, where you see everything you're doing, which is the way I do the surgery. And I'll try to explain that better. Surgeon can make an incision in the armpit, force open that space for the implant with what we call blunt instruments that isn't without seeing anything you're doing. And I think that's really important for patients to know. You can go to a plastic surgeon and they'll offer you an armpit incision, but it's really important to ask how are they going to do it. You don't want somebody operating on you but not seeing what they're doing. I think that's pretty obvious, and that's something that you really need to ask a plastic surgeon if they're going to offer you an armpit incision. If you don't see what you're doing, you can't do things precisely. You can't look at the anatomy of somebody's chest, and everybody's anatomy is a little bit different, and there are variations that you can't address unless you see what you're doing in surgery. And the other critical thing is bleeding. You have to control bleeding. It used to be in the old days that people just do surgery as quickly as possible because the patient would die because they would bleed to death. Now, you don't want to be operated on like that. You want your surgeon to control every little tiny blood vessel that is visible to them so that your bleeding is minimal. Not only is it safer, it's going to decrease your pain, bruising, and swelling after your procedure, so that shortens your recovery. And what I think the most critical thing for breast implant surgery is that a larger amount of blood around an implant is going to predispose you or increase your risk for what we call capsular contracture. Capsular contracture is a complication that can happen with any breast implant surgery, and we really want to avoid it as much as possible. We don't know exactly what causes it, but there are two things. One is blood around the implant. They've done studies in lab animals, poor animals, but what they did was they put in a tiny implant, put blood around it, and they found that blood around an implant gave a higher risk of that hardening of the implant, that misshaping of the implant that was caused by all that scar tissue around it. Any maneuver, any effort to reduce the amount of blood around the implant is going to decrease your risk. And I urge you to seek a surgeon who can offer that to you, or who is thinking about that, especially in the case of armpit incision breast augmentation, so that you can lower your risk for that complication as much as possible. The other reason why I think an armpit incision is safer is the distance from the incision to the implant. Now, the other way contracture can happen is we believe bacteria get on the implant, your body doesn't like it, forms that scar tissue around it, and it's usually not enough to form an infection, although we do know that when a breast implant gets infected, there's going to be a higher risk of contracture, but it could be enough to cause contracture, but not any visible infection. That's one theory of how capsular contracture forms. You have a little bit of implant you have a little bit of bacteria on the implant, your body doesn't like it. The implant itself can't get rid of the bacteria gets stuck to the surface of the implant, and your body starts to react to it by walling it off, creating that scar tissue, that contracture around the implant to contain it. A lot of the bacteria on our body that causes infections are on the surface of our skin. So any close proximity between our skin and the implant is not a good thing. In the case of an incision underneath the breast, sometimes that distance from the skin to the implant can be paper thin, super thin. We're talking about 2, 3, 4 millimeters. The other thing that patients need to consider is that incision beside the areola, I feel, is the highest risk for infection and capsular contracture, two things that you don't want when you get breast implant surgery. The reason why, I believe, is that your breast is designed to make milk. You have glands that produce that milk, which drain into little tubes. Little tubes are called ducts, and they all converge on the nipple and areola because they're designed to deliver milk from the breast to the baby's mouth. Now, those tubes are always filled with some kind of fluid, and that fluid is very high in bacteria. So any incision beside the areola is going to go through those tubes, bathe that implant in that fluid which contains bacteria before it's placed in the body. That's why I found, and studies that have been conducted also show, that the implant infection risk is higher when that incision is used. Most surgeons who do breast implant surgery don't favor that incision. Most are shifting towards incision underneath the breast now, which, as I mentioned in previous videos, is the most obvious incision because of that infection and contracture risk, I believe. It's very rare to get an implant infection when the implant is placed through armpit incision. The distance between the incision and the implant can be about this long, much longer than it is with the breast incision, either underneath the breast or beside the areola. And I really feel that that's one reason, because the implant is so protected, that the risk of infection and contracture is lower. If you're thinking about breast augmentation, please talk to your surgeon about what incision they're going to use, why, and how they're going to be placing the implant. These are all very important questions to ask going into surgery so that you can get the best result with the lowest risk of complications. Stay tuned for the next video where we'll be talking about scarless gynecomastia or male chest contouring surgery.